Pleural fluid analysis. A pleural effusion is an abnormal accumulation of fluid within the pleural space. Under normal circumstances, a small amount of fluid is continuously produced and reabsorbed within this space to maintain lubrication and facilitate smooth movement of the lungs during respiration. However, various pathologic processes can disrupt this equilibrium, leading to excessive fluid accumulation. Pleural fluid should be taken by thoracentesis to analyze it. Thoracentesis then first by applying a local anesthetic to the area and a hollow needle is inserted into the pleural space to withdraw a fluid. Typically, a patient is seated upright with arms resting on a table. 1 to 2 intercostal space below upper level of pleural fluid in mid-scapular line or 5 to 10 cm lateral to spine is the best place to insert a needle. During this procedure, there is a risk of pain, bleeding, or rare complication like pneumothorax, but which is rare. The primary goal of pleural fluid analysis is to differentiate between transudate and exudate using the specific biochemical parameters. According to Light's criteria, we call pleural fluid a transudate if effusion protein to serum protein ratio is less than 0.5, absolute LDH level in pleural fluid less than 200, and the effusion LDH to serum LDH ratio less than 0.6. Whereas effusion protein to serum protein greater than 0.5 is exudate, LDH greater than 200 is exudate, and also effusion LDH to serum LDH ratio greater than 0.6 is exudate. Common cause of transudate infusion include heart failure, cirrhosis, and nephrotic syndrome, whereas exudative pleural effusion is caused mostly by infectious malignancy, pulmonary embolism, and autoimmune disorders. In addition to Light's criteria, we can also use total protein in the pleural fluid. If it is greater than 3 grams per dl, it is exudate, and if it is less than 3, it is transudate. During pleural fluid analysis, we should have to check the physical or gross appearance of the fluid. They do chemical analysis such as glucose, pH, amylase. They do cell count and with differentials, the microbiology, gram stain culture, and the cytology. Normal pleural fluid characteristics include color, it is clear. Normal pleural fluid is a clear ultrafiltrate of plasma that originates from the parietal pleura, so it's clear. pH is between 7.6 to 7.64. Protein content is between 1 to 2 grams per dl. And there are fewer than 1000 WBC per cubic milliliter, and 60% of them are mesothelial, 30% monocytes, and 5% lymphocytes, the rest neutrophil. Glucose content is similar to that of plasma, and the LDH content is less than 50% of plasma. So, if the glucose content of pleural fluid is less than 60 mg per dl, it may indicate empyema, rheumatoid arthritis, or malignancy. pH less than 7.2 suggests complicated effusion requiring drainage. High level of amylase in pleural fluid might show pancreatitis. Cell count with neutrophil predominance may suggest acute process like pneumonia, whereas cell count with lymphocyte predominance is mostly due to tuberculosis and malignancy. In addition, microbiology such as gram stain culture is used to identify the etiology, and the cytology is used to identify malignant or cancer cell. In addition, we can do special tests which are optional but not significant, such as adenosine deaminase. Adenosine deaminase above 40 is strongly suggestive of tuberculous pruritus, whereas triglycerides greater than 110 indicates a chylothorax. A pleural effusion is classified as empyema when there is pus, gross pus. Pleural fluid is purulent or turbid. In addition, When there is positive gram stain or culture from the pleural fluid, it is empyema. In addition, on biochemistry, pH less than 7.2 and low glucose, especially less than 40, and very high LDH greater than 1000 shows empyema. In addition, on cell count, if the cell count is greater than 100,000 neutrophils per microliter, it is empyema. And also on imaging, ultrasound or CT scan, if it shows septation or loculation or thickened pleura or split pleura, it is an empyema. As a summary, Light's criteria is a test to determine whether a pleural fluid sample is transudative, low protein, or exudative, which is high protein. This determination narrows the diagnosis of etiology or differential diagnosis of the cause of pleural effusion. Thank you for watching.